Welcome to the Slop Temple. We pray this video helps.
You start by preparing both the device and the patient. This reduces discomfort and infection risk. Wash your hands, clean the Frida Mom rectal thermometer, and apply a thin layer of water-based lubricant to the probe tip. Once done, place the infant in a secure position, on their stomach across your lap, or on their back with knees toward chest, to keep them steady. Make sure you have a clear view and can gently insert the probe about 0.5 1-inch for accurate readings. Now you perform the measurement. With one hand, stabilize the infant and use the other to insert the lubricated probe gently into the rectum about 0.5 1-inch, stopping if you feel resistance. Hold the thermometer steady. Many Frida models beep or show a stable number when done. Watch for that signal. Make sure to keep the child calm by speaking softly or offering a distraction, because movement can alter the reading and make the probe shift. Finish the process by removing the probe gently and reading the temperature right away. Record it if needed for tracking or to report to a clinician. Clean the thermometer with soap and water or an alcohol wipe and store it safely. If a value seems inconsistent, too low or high compared to symptoms, wait 5 minutes, repeat once, and compare results. If still off or the device malfunctions, replace batteries or contact pediatric advice. Always trust persistent symptoms over a single reading.
Thanks for watching. Consider subscribing if we helped you.